I understand if Mo can't use a mobile phone or the app, I think you can do it on a computer as well. But it means if the vast majority of us that can use that technology do, it means those that can't have more time and space.
Do you think that there is a divide in this country between people who live in rural areas and people who live in big cities like London, that people in rural areas tend to get a much more personalised service?
You're right and wrong, actually. It isn't. There are more. People in rural areas tend to be better off, and they tend to be older. And if you're older and better off, you get more resource because actually you're fitter at an older age, so you don't need as much. Whereas somebody in the inner city who's young and sick uses an awful lot of resource. So, yes and no. I think where we have the big divide is around deprivation. So the most deprived areas, whether those are seaside towns or the middle of London, you have fewer doctors, fewer staff and harder work. So that's the real divide, is deprivation.
Mo, thank you very much. Let's go to Angela in Brighton. Hello, Angela.
Hi, Dr. Clare. I was a patient of yours back in the late 80s, early 90s.
Was I nice to you?
Now, this could go one of two ways.
Oh, gosh, Angela.
I was a staff nurse in the emergency department at St Thomas's, which is your local A&E department. And I remember you with much admiration. And
Thank goodness for that.
Career and, I was a nurse consultant in urgent care for years, but my first degree was practice nursing. I spent years as an advanced nurse practitioner in general practice. And I want to ask you about the diversification of roles in general practice, because general practice isn't like it was back in the day. And I wonder what your view about diversification in general practice is, because there are roles for all sorts of other clinicians other than GPs. And I think it's really important that patients understand that they're not getting a second-class service if they don't see the GP.
No, Angela, thank you so much. I have to say I don't remember you, but so that means I can't breach any confidentiality.
Oh, don't worry, I wasn't married. It was a long time ago.
But thank you so much for your kind words. You're absolutely right. Unlike a few years ago, probably if you were working in A&E at the time, just at the start of, I think, probably the middle 1990s, we started to diversify. And first of all, we got independent nurse prescribing and prescribers and nurse consultants. And now we've got a whole range of other staff working with us who are fabulous. We've got fabulous paramedics who I think are as close to GPs as you possibly can. Nurses, of course, who are able to deal with a lot of the chronic complex diseases. We've got pharmacists who save our lives by picking up our errors and do medication reviews. We've got physiotherapists, and we've got a new group which listeners might not have heard of, which is called social prescribers, which help us navigate patients through some of the complexity of the systems, and maybe also help with some of the social issues out in the community. So, and many, many more. And you're absolutely right. We're one family delivering community-based care, and it's certainly not second-class citizens if you're being seen by a nurse or a paramedic. In fact, I think you're probably very, very lucky to be seen by a nurse, because you have skills that I can only dream of having. And paramedics, they're new in general practice, and I'm amazed at paramedics because they're probably the only group that see sort of from cradle to grave, irrespective of the diagnosis, and do a lot of the first contact undifferentiated work. But you're absolutely right, Angela. We have a whole number of different staff, and I forgot, of course, physician associates who again work alongside us. But if you want a job, Angela, I know a really good practice in South London. If you want to come back from Brighton,
then I'd love a job. Let's get in contact.
Well, contact me. You can find my email on the internet.
Oh, and I will.
Oh God, you're going to regret saying that. Angela, thank you very much indeed. Just before we go to the news, A few years ago, walk-in centres seemed to be the thing that the government were trumpeting, saying we're going to have a lot more of these, but you don't hear about these anymore. Did they not work?
They do work. There are a few walk-in centres. I think they're called urgent care centres now rather than walk-in centres, and they do work. My last on-call ever, which was last Christmas before last, was in an urgent care centre, and where you have diagnostics, so you have X-rays and you can take blood tests. But what we haven't got are places that we can keep people for a whole day and watch them, which were promised in the early 90s, and we haven't got places where somebody's just off their feet, in inverted commas, we can admit maybe for 2 or 3 days just to look over them. But urgent care centres do exist.
Anthony says, I live in North Devon. I cannot praise the South Molton Medical Centre enough. Their digital online consultancy is brilliant. They respond within hours despite being a very busy practice. I'd recommend not phoning your GP surgery and use online where you can. And I wonder whether, as the older generations leave us, who are not as technically advanced, he says, treading very carefully with his words, the generational shift will mean that people do use digital means to consult their GPs far more than maybe they do now.
We saw 1,000% increase during the pandemic of use of digital. There are some people who will never be able to use digital, people with severe learning difficulties, people with Alzheimer's, the very elderly, and those who technically can't. But we make a lot of things up, Ian. We say, for example, those where English isn't your first language can't. Yes, they can. They get their daughter to help them. They have a much better grip of things. We talk about people saying, well, people with mental illness can't. They can. It's one of they actually prefer it, as do people, for example, who've got sexual health problems, prefer digital. It's far less embarrassing. So I think we mustn't make things up. We must look at what patients want, and we must follow what's happened in banking. It doesn't mean you can't see somebody face to face if you need to, and let's be absolutely clear. But do you want to go and spend half a day sitting in a surgery with other patients coughing and spluttering over you to get your repeat prescription of the contraceptive pill? No, I certainly don't. Not that I'm on the contraceptive pill anymore. But so I think digital will work. But what we've got at the moment is not enough GPs. As we've opened another lane of the motorway with digital, we haven't got enough to deal with it. But South Molton practice, well done. And thank you very much for your fabulous service.
That is the last practice that I'm going to mention, because otherwise we could be here all night. But we know the problem is when you talk about the NHS, and inevitably when we talk about it, something has gone wrong somewhere, or there's a strike or something. And I'm always very keen to sort of mix the bad news with the good as well, and sort of ask people for their good experiences. But let's just assume that your own GP practice is fantastic, and then we can get more calls in. Right, it's 8:32. News headlines with Dara Jackson.
Anyone hoping to join the Metropolitan Police who has an adult caution could be banned from joining the force. Sadiq Khan says he would back the new Commissioner Samart Rowley in introducing tougher standards. The family of a woman who was murdered when her husband pushed her from Arthur's Seat in Edinburgh say they face a lifetime of grief and pain. They were in court to see Kashif Anwar jailed for at least 20 years for killing Fauzi Ag Javid. Fires have been burning in protests on the streets of Paris again. It's the 11th National Strike Day over pension reforms. LBC weather, lingering showers for eastern areas of the UK tonight, feeling chilly and a low of -1.
This is LBC.
6 on LBC. Clare Gerada is with us. She's a GP who practices in South London, also the president of the Royal College of GPs. Now, a text here, Clare. I'm a junior doctor on my way home from a 12-hour shift. I'm deciding whether to remain in the NHS and train as a GP, or to follow many of my colleagues to greener pastures in Australia, or to quit being a doctor altogether. How can you persuade someone like me that the shocking working conditions in the NHS are worth continuing with?
Yeah, and it's a question that I hear all the time, because I, until recently, looked after lots of mentally ill doctors. The first thing is the grass is not greener on the other side. I've recently reviewed a PhD from an Australian doctor looking at the underbelly of working in Australia, and there are long hours and there are problems if you're an immigrant, which you will be, and there are problems with having to work in a system where you're actually asking for money. Now, I don't want anybody from Australia to ring me, but it's just summarising it. So there are problems with every single country. So what can I say to you? What I can say is that over the course of a career, which I'd take would be 30, 35 or even 40 years as with me, it is the most extraordinary job being a doctor. It is and especially being a GP, I still have unbelievable joy when I see patients. And I say that in all honesty, and bear in mind I have it easier because I'm older and can control.
There must be a few that don't bring you unbridled joy.
No, not a few, but the absolute professional satisfaction of making people feel better with the skills that I've got. Now, maybe you heard Angela, who was my patient. The only thing I want of patients that I've seen is that they remember that I was kind to them. The skills that I bring, they probably won't notice, because most of what I do isn't saving lives. Most of what I do is stopping bad things happening to people and actually making them feel better when they walk out of my consulting room. And to do that over the course of a career is unbelievable. And I don't think there is another career that gives you the flexibility that medicine does. So, for example, if I wanted to leave tomorrow and go up to Tunbridge Wells, where Iain is, I could get a job within a day, 2 days.
Really?
Within a day. I probably, that's even longer than it would take, probably half a day. I earn a lot of money. I have a lot of control over my job in general practice. I'm not so sure in hospitals, because I haven't worked in a hospital now for many years. So what can I do to persuade you to be a GP? It is a wonderful profession, but of course at any point in time there are bad things. And if you Google, as I have done many times, the end of the NHS, you'll see right from 1946 people were saying it's the end of the NHS. And if you were saying...
Hadn't even started then.
It had just started. Just on the first... 1948, the first days, the end of the healthcare, whatever. So what can I do? You've trained very hard. Stick with it. It's a fabulous profession. And yes, please become a GP. You'll have much more control over your own life.
And more money, because GPs are better paid than junior doctors, aren't they?
Well, we're not junior doctors, Iain. We're the same as a consultant. So we are better paid than juniors because we are consultant equivalent. So I would hope we would be. We're paid probably about the same, if not more, than an NHS consultant if you take like for like, because we work longer hours than, it's quite complex. But certainly we're on par with hospital consultants. But you've got a secure income. As I said, if I wanted to move tomorrow, I could get a job. I can, if I really needed to put the accelerator on and do more work, I could do. And there are very, very few jobs that give you that. And as I said, the patient contact, it's the clutter around it. It's all the bureaucracy, as I think you're probably having in hospital practice, that takes the joy away from the work. But the actual patient contact in that consulting room is fabulous.
You see, I think that's a common theme that you hear from people in the world of education, whether it's in universities or predominantly schools. Where they say, well, if we didn't have all of this bureaucracy that we have to contend with every day, we could actually do our jobs better. And that has to come. I mean, it is a national health service, so I suppose that sort of has to come from the top to say, well, do we need these particular forms, or can this computer system be adapted to make life easier? I mean, as far as certainly when I visit my GP, I look at her. She's tapping away into her computer, And it's not quite Windows 95 that she's using, but it's not far off it.
Not far off it.
And
My
I'm
computer
thinking,
doesn't have a webcam, so and there isn't Wi-Fi. So if I need to
there isn't Wi-Fi.
Well, it's very poor Wi-Fi.
How can you operate?
Exactly. I mean, there's Wi-Fi into the system, but not
Right.
but not if you have devices that you need to connect to the Wi-Fi. So and GP,
Is that because all the money is diverted into capital expenditure rather
we
than
certainly
spent on
don't have
IT?
we certainly don't have a lot of capital expenditure in general practice in terms of our buildings. I mean, again, it's frustrating. It's frustrating to take 15 minutes to log on in the morning. It's frustrating when it crashes.
Seriously, that's what it takes.
Seriously, that's what it takes.
See,
Seriously.
I mean, that is utterly ridiculous,
and if
isn't
you're
it?
an impatient person like me, you've literally got to leave the room because otherwise you start switching it on and off again.
And then getting annoyed, and then your
getting
first
annoyed.
patient comes in, and maybe you're not quite as understanding as you might be.
You always start behind unless you go much, much earlier. Now, if you log on from home, it's much quicker, but you're logging on from... Now, so these things need to be sorted. The bureaucracy, the form filling, the different forms. We have hundreds of forms that we have to use if we want to refer people. It will be sorted, though. It will be. I have great confidence, actually, in the NHS executive in sorting
Let's
it.
go to some more calls. Let's go to Victoria in Glasgow. Hi, Victoria.
Hi to you both. Apologies if you can't hear me very well. I've got COVID just now. So this is something I had got incredibly frustrated with my doctor's surgery. I'm a psychotherapist, have been in private practice for going on 10 years now. And I needed a repeat prescription, phoned half a dozen times one of the days, could not get through, managed to speak to a receptionist at a few minutes past 4 in the afternoon and was told you can only put a repeat prescription in until 4 o'clock. So there was absolutely no come and go with that with a few minutes. By the time I'd explained I couldn't get through the umpteen times earlier in the day, I'd asked to speak to, because this kept happening, I'd asked to speak to the practice manager and was told, well, even though we're open till 6 or half 6, the practice manager finishes Monday to Friday at 4 o'clock. So that wasn't any use to me either. So I then was told I had to phone back the next morning. Luckily, the next morning I got through fairly quickly. But I was told with the triage system, with a doctor calling me back, they could not give me any time. Now, me being a psychotherapist and having my clients, it's the equivalent of a doctor having to interrupt a patient that they've left to say, hang on a minute, can I just take this phone call? You can't do it. It's completely unprofessional. There's no way that anyone would ever do that. So how do we get round this? The only way that I did, I had to contact my local MP because this situation was going on for months. And that is the only way it got resolved. Now, I like to think I'm a fairly reasonable person. I'm pretty patient. But I was at the end of my tether with that situation that then made me have to...
As anyone would be, Victoria.
And Victoria, I hope you get better from COVID. It's coming round again. Yeah, I mean, what you're describing is awful, to be honest. And I do recognise what you're describing because in our own practice many years ago, we used to have a system that you had to give your repeat prescription by a certain time so that we could get it to you within 48 hours, okay? But that was pre-digital. That was about a decade ago. And being given the runaround of, ringing up to get a repeat. So, and I don't quite know, I'm afraid, how things work in Scotland, so I don't know whether...
according to Victoria, they don't.
Well, they don't. And Victoria, again, I can't excuse what you've experienced. I think it's awful, but I just hope it changes because you're right. I don't know what your repeat is. It may be that a doctor needed to authorise it because it's a complicated repeat, but we should do things easier and we should put the patient first, and actually the doctor doesn't want to be given the runaround. And when I see patients who are given the runaround, they're passed from pillar to post, and I just find it appalling. And I talk about it with my own organisation and with others because problems happen, but actually we need to try and sort this out. And you're doing a fabulous job keeping the mental health of Glasgow, of your clients, and we should maybe not add to your mental health burden. So hopefully your MP has sorted it.
Victoria, thank you. Interesting text here says, I'm a hospital consultant. She keeps saying wrong things about us. We work far harder and get less money. GPs are a bit greedy. There is a bit of competition here, isn't there?
Well, myself. I'm sorry if you feel like that. I'm not. I'm not trying to split between hospital consultants but we do know that the crisis is actually right across the NHS. But actually, general practice is acutely a problem at the moment. So, for example, we get 7% of the NHS budget for about 80% of the activity. We know that there's shortages across the NHS, but they're particularly pertinent in general practice. And we know that if general practice falls over, if it really falls over, the rest of the NHS is going to fall over. And I'm not against hospital doctors. Of course, I'm not. My husband's a hospital doctor. But just to put things in perspective, because I don't think people often think this, but we consult with 5 times as many people that would go to an outpatient clinic on a given day, and 10 times more people that would go to an emergency department in any given day. And GPs on the whole are only paid for doing consultations, so there isn't time. There's some complexity. I don't want to, but it is quite complex. But on the whole, our contract is doing clinical work, whereas hospital doctors who work very, very hard, I'm not trying to split, there are other bits that are added on to their role. But please forgive me if I'm saying that it's sounding like I'm against hospital doctors. I'm here as a GP trying to rescue general practice, because as I said, if we don't rescue general practice, I'm afraid the rest of the health system will fall over. 1.3 million people per day contact a GP, 1.3 million. If we had even 10% of those people having to go to accident and emergency because they can't see in inverted commas, consult with us, the system will fall over.
Stuart says, the lady, as opposed to she, you have on sounds lovely. She has that reassuring voice and knowledge that as a patient you find so calming. Can I sign up to her surgery? Stuart in deepest Essex.
Contact me. We don't need patients.
I suspect his tongue was firmly in his cheek.
And thank you very much for that. I hope that I'm a reasonable GP.
All right, let's take some more calls in just a few moments' time. It's 8:48.
LBC.
And we have Clare Gerada with us, GP, and she's taking your calls on how to make GP services better. Raman is in York. Hello, Raman.
Hi, Ian. Hi, Claire.
Hi.
Can you hear me?
I
Yes,
can,
we can.
Raman, yes.
Okay, brilliant. So I'm a medical student at the University of York, and what I've noticed there, because we attend GP surgeries every week, is that it's been a couple of years in the process, but they've sort of merged all the GP surgeries there, and it seems to have an effect on sort of how long people are waiting for sort of appointments, because they can just turn up to any of those GP surgeries having made an appointment through the website. And I've noticed going back home to Watford as well that they're sort of starting to do the same thing there. Is that an initiative that is sort of in the making, like our GP surgery sort of combining to ease their workload?
Yeah, thank you, Raman. There's a very interesting model of sort of general practice in York, actually, which, as you describe, is all the practices coming together and actually then saying, well, a patient can be seen anywhere. We'll start to look at how we can deliver different services in different places. So, for example, diabetes care or respiratory care. And it is working. It's not just economies of scale, so saving money by maybe being able to share staff and back office function, but actually making it easier for patients who need to be seen. So, but it's the sort of opposite of what Ian said, which is small is beautiful. But actually what we need to be able to do is to be able to deliver two things, really. One is access, so if you need to be seen today or tomorrow, you can. And the other is continuity, which means if you can wait, and many people who want continuity can wait maybe 2 weeks or 3 weeks and see the same person, whether that's a nurse or the GP. So if we can try and do that, then I think we start to deliver very good care for patients. And I know in the York area they are beginning to do that. Other areas do it as well. So let's watch this space. And I hope that you're going to train as a GP once you finish your student training.
I hope so, yeah. We'll see.
Not there's anything wrong with hospital practice, as I want to say. She added hastily. But general practice is a wonderful career.
We do get a lot of exposure to general practice, and I think even in so we go to Hull as well, and even in Hull they're starting to sort of merge like a few practices together. So I'm just seeing this trend, at least in the Yorkshire area, that practices are merging.
Yes, I mean, and again in the Hull area, which is an area that has a lot of deprivation, they're able to get round sort of the burnout in the clinicians and also deliver more for the same resource by merging practices. It doesn't work everywhere, but it's certainly where it's being tried, and these are large practices. It certainly does work. But what actually both of those areas are actually marked by having very good leadership, and I think very good primary care GP and senior primary care nurse leadership to be able to do things in the right way and not lose out on what is the essence of general practice.
Raman, good luck with your studies. Thank you very much. Sean is in Chelmsford. Hi, Sean.
Yeah, hello, good evening. Thanks for taking my call, Ian and Claire. I just wanted to talk about, it's really an observation more than anything. Earlier on you spoke about the differences between large surgeries and smaller surgeries. In my own experience, smaller surgeries, and certainly my own surgery, there's absolutely no resilience at all if there is an absence at a smaller surgery. I've had 3 appointments cancelled in the last 5 weeks, and now, because of the backlog, I can't be seen until the end of this month. Again, I won't know until on the day, on the morning, whether or not that appointment will be cancelled again. At this point, I'm not sure when I'll be seen, and so I don't have a problem, so to speak, in terms of it being cancelled if there's absences. I just wanted to highlight the fact that it is absolutely true that if I had a choice, I would prefer to be with a larger practice than a smaller one that has no resilience whatsoever.
And I think you're right, Sean. The pros and cons, and it's what I was saying to Ian about. You only need somebody to get ill. And we saw this during COVID, even with the larger practices. At one point, we had about 50% of our staff off with COVID. But we were able to flex a bit. I'm not saying we were perfect, but if you're a smaller practice, then, as you said, there's very little resilience. I hope you do get an appointment, though, because waiting to the end of the month, albeit we've got Easter, which is always complicates, and we've got, bank holidays. But and again, for anybody listening, access is a problem at the moment, but we are trying to make sure that we see people who need to be seen, and there are different ways to get into the practice, to actually get through the system. But if you do feel unwell, and if you really think you need to be seen, or your members of your family, then just persevere. We really do want to help. We don't want patients to suffer. And so please, Sean, if your problem is urgent and it's been cancelled 3 times, I think you probably need to be just saying, I need to be seen, unless it's not an urgent and it can wait till the end of the month.
Sean, thank you. You mentioned gambling earlier. We're going to be talking about the government's idea to place limits on the amount that young people can gamble up to the age of 25. Now, I've done a lot of phone-ins over the years on gambling addictions. Do you think that this is something that might actually help, particularly people who are of a younger age?
Yeah, Iain, I've looked after addicts, heroin addicts, cocaine addicts, alcoholics, you name it, and now gambling. And the worst, it's awful to compare different addictions, it really is, but the one that causes the most harm, not just to the individual, but to the families around them, the one that can cause devastation within minutes is gambling. And I think anything that can restrict people, the amount that they put on, put a delay in on certain amounts, I think can only help. This is a terrible addiction that's just everywhere. It's in your face all the time. You just need to watch the television. You just need to look at any sports programme. And it's particularly targeting young people. And it's not vast amounts. We're not talking about 10, 15, 20,000. We're talking about maybe £100 or £200 a week. But these people cannot afford it. And once you're in there, you're in there. And I'm not saying you're in there for life, but it is a devastating addiction, and I think we really have to tackle it very, very seriously.
Do you think it's getting worse?
Oh, yes. And again, since the pandemic, because people went online, they don't go into the bookies as much, and it's a hidden addiction. It's one that particular women are there at home gambling in ways that we think, scratch cards, online gambling, and yes, it is getting worse. And very few people who have a gambling problem are actually in treatment, and we need to do everything to stop it happening in the first place. I'm not against the odd flutter, of course not, but we have to put restrictions on people gambling literally their life savings in a matter of minutes.
Well, I wish we could carry on doing this for another hour, because we've certainly got enough calls to do so, and I'm sorry to Simon, Andy, Liv, Dave, Hannah, Bernard, Sharon, that we couldn't get you on this hour.
Any more of my patients?
Not yet. I haven't seen any, but there's so many calls about saying, I can't get to see my GP. That seems to be, I would say, 60-70% of the calls were in that vein tonight, which I'm not necessarily surprised by that, but it is indicative of the problem out there.
And it is a problem, and we're trying to deal with it, and hopefully the cavalry, in terms of the, as we heard from one of the callers, nurses, pharmacists, physiotherapists, paramedics helping us, will be able to sort that out.
Claire, thank you so much. That's Clare Gerada there. Now, coming up in the next hour, as I said, we're going to be talking about gambling, because young online gamblers will face limits on the amount that they can bet under new laws reportedly being lined up by the government. The Sun newspaper has said that ministers would consult on capping bets to online slot games to between £2 and £15, with a £2 limit for under 25s. Gambling firms will also be taxed to fund addiction treatment, according to leaks seen by The Sun. I wonder whether you think that this will help. There is no silver bullet in these situations, is there? But I suppose every little bit helps. If you are under 25 and you think you have a gambling addiction, give me a call. I want to hear your experience. 0345 6060 973.
On your radio, on Global Player, and
Play LBC.
Leading Britain's conversation. This is LBC.
From Global's newsroom at 9 o'clock, Sadiq Khan has told